Albuterol is a bronchodilator commonly used in emergencies to relieve bronchospasm in patients with asthma or chronic obstructive pulmonary disease, or COPD. Depending on the patient's condition and response to treatment, a paramedic may administer albuterol via a nebulizer or metered-dose inhaler, or MDI. Indications: acute asthma exacerbations, COPD exacerbations, anaphylaxis in conjunction with other treatments, respiratory distress with wheezing. Dosage: for adults and children, nebulizer, 2.5 to 5 milligrams every 20 minutes for up to 3 doses, then as needed. MDI 90 to 180 micrograms or 2 puffs, every 4 to 6 hours as needed. Contraindications: hypersensitivity to albuterol, severe tachycardia, certain arrhythmias. Side effects: tachycardia, palpitations, tremors, nervousness, headache. Precautions: monitor heart rate and respiratory status. May require repeated doses depending on the severity of bronchospasm. Use cautiously in patients with cardiovascular disease. Administration: if using a nebulizer, prepare the medication as per protocol. Ensure the patient is in a comfortable position. Educate the patient on the use of an MDI if applicable. Remember to follow your local protocols and guidelines for administration and dosing.